I do think that everyone in the industry needs to be aware, both in the emergence of these medications, but to Joanne's point, just in general, sort of a heightened awareness around the quality of food. And again, I go back to sort of how food makes you feel. That the trends that I think many thought or many prognosticated were sort of health and wellness fads are here to stay. And I think it's really important that manufacturers and brands get ahead of those realities, because some of the dynamics, some of the foods that are out there that have been most of the innovation is around tinkering around the edges, making them slightly less caloric or slightly less, reducing sodium by just a bit. I think that's going to be hard to sustain in the long run as more and more awareness emerges. I also think it's important, I recognize we sell branded product that is at quite a premium, and that in order for us to be able to get to a larger subset of the population and to ensure that healthy, convenient food is accessible, it's going to take partnership. It's going to take change in both the manufacturing space, but also in the agricultural world. There's going to have to be intersections with the future of food from a governmental perspective. And so while we are, all things considered, a relatively small brand in the grand scheme of things, we take our role very seriously around trying to engage and influence more macro evolution of the industry as a whole. I don't think this is going to be resolved in one innovation cycle, right? It's going to take decades to really get ahead of what we're seeing.
Thanks, Ricky. Joanne, what do you think? Should manufacturers be concerned, worried?
They should be aware and do scenario planning. I think it's interesting the approach that Ricky has taken, because I think, how can you make your consumers' life easier, right? That's the bottom line. And what I'm seeing with these drugs is, they're originally, people seem to think you had to be on them for life. Now I'm seeing a lot of evidence and people talking about going on them from time to time, but trying to maintain the same way and same behaviors. So I think there's a role, not just while people are on these GLP drugs, but pre and post that journey. I think there's a role for food manufacturers. And, something's happening out there. I don't know if anybody, I pay attention to lots of different industries. January, gym memberships are usually way up. This year, they were way down. There weren't a lot of new gym memberships. And yes, could that be a function of inflation? Potentially, but I think there's more going on here, and that maybe people are always looking for the easy way, right? We all know we should get 30 minutes of exercise a day, and it's better than any drug you can take, but how many people actually do that? So, as humans, we're wired to look for the shortcuts. So I think people will gravitate towards potentially this way of eating and using these drugs occasionally.
Thank you, Joanne. I agree with you. For me, it's always a challenge. When I finish my workout, the first thing I say, thanks, Nithya, for showing up on the mat, because that is a challenge. So I agree with you. Jane, what is your perspective? I know when we discussed, you had a slightly different perspective on this. So
again, I think, the manufacturers need to be aware of this. There's, on the medical side of the community, and Joanne brought up a good point, the therapeutic use versus the cosmetic use. And so that's a challenge, an ethical challenge that we won't get into, but these drugs are very serious. And again, as I mentioned, obesity has been a medical term for decades. It's again a chronic disease that has many factors. And so it's not just consumption of food, it's not just lack of exercise. It is genetics, it's your biological sex, it's your age. Like, trust me, as I'm getting older, it's more difficult for even cravings. Like, your cravings can change at different life cycles. You talk to a pregnant woman and things are happening there. So manufacturers need to be aware. They need to be aware of this, of this class of drugs. We've never seen weight loss drugs so effective before. So I've been in 3 decades of the RD world as well as the food world, and we've never seen such effective drugs. So again, the manufacturers need to be aware, and the focus on palatable, nutrient dense foods that people can afford.